Hi, my name is Justin Woodside. Today I'm here to talk to you about the diabetes treatment that we do in our office. I'm going to keep it short and sweet so you can understand this. So here in this picture we have a patient who's a non-diabetic and everything in their system is working correctly. You notice these lines going up and down. That is the cycle in our body between glucagon and insulin. And that is very normal. That happens about every 4 to 8 minutes. And a patient who's diabetic, this cell right here represents major insulin resistance, meaning their cells are not sensitive to insulin and they're not using insulin to get glucose into the cell like it normally should. So you can also see that their insulin and glucagon numbers are all over the map. What our treatment is it's an IV infusion therapy. We use fast-acting insulin and an IV pump to actually slowly microdose insulin. And we do that every 4 to 8 minutes. When we do that, we mimic what the body should be doing. We drive their sugar, their A1C, and all their complications of diabetes down and increase the way the patient feels and their energy levels and things of that nature improve. So ultimately what we're doing here is changing insulin resistance to improve it and get their insulin receptors sensitive again so that they're working and functioning normally. The treatment itself is a 12-week program. They're seen twice a week in the beginning and then once a week later into the treatment. Usually they do twice a week, anywhere between 1 and 6 weeks, depending on the severity of their issue. Ultimately, we treat type 1, type 2, pre-diabetics, and we treat metabolic syndrome. We help all those patients and see vast improvements. Next picture I want to show you really quick is what our treatment area looks like. We have some simple recliners. The infusion is 3 hours long, and it's the consistency of this treatment. Like most people know, if you get an IV infusion of insulin, it's going to drop it way down really quick. But it's the consistency in creating that metabolism and that metabolic burn during the insulin treatment. And again, it's microdose. But they're nice and comfortable. They can watch TV. They can play on their iPad, whatever they'd like to do. Next picture is going to be what does treatment look like. So it's a very small medication pump that is used here. That's actually smaller than the size of the cell phone. It's a little thicker. But this is a 20 cc syringe. And on a normal patient, we may use somewhere between a half and 1 ml of insulin. So a very small amount of insulin mixed with saline, and the pump controls how much goes through here. We AccuCheck them a minimum of 7 times, check their vitals 3 times while they're in. So it's very safe, very simple, but also very effective. Patients can get up and use the restroom and things like that during their treatment as well. Next picture is just a little bit about results. This is a picture of a diabetic wound 4 infusions later, picture of a diabetic wound 8 infusions later, picture of a diabetic wound 5 infusions later. The results are quick because, again, we're driving their sugar down and making huge differences. There's a lot of research behind this. We know it decreases insulin requirements, improves wound healing, reverses diabetic neuropathy, changes and decreases hemoglobin A1C. We see changes in diabetics that have kidney issues, that they can start to see their kidneys improve, changes in blood pressure, and all the other complications that you would see with a diabetic patient. We have over 20 research papers. If you receive this in an email, you may have actually gotten some of those research papers, and we're happy to share those. This treatment is real. It does work. It does take some time and dedication on the patient's part. But once patients start this treatment, they're going to see a change, and you're going to see your patient be able to do more of what they want or receive other treatments that they can't get currently because they're diabetic, because this is going to actually improve their issue. We do keep the patient on any medications they're currently taking. We're not going to take them off those unless the improvement is so great with the treatment that it warrants it, and then we'll send them back to their primary care to do that. Thank you for your time. I hope you've learned something. We're always open to questions. Reach out to us. Thank you. Bye-bye.